Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Today our show is titled, Your Health is in Your Gut. And Dr. Prather, we're talking specifically about the GI Effects Stool Kit, which is one of the 3 tests you recommend everyone have on an annual basis, along with the Prather Profile blood analysis and a hair analysis.
Yes, these are 3 tests that I recommend for our patients for basic health, and this applies to everyone of whatever age. Mm-hmm. You know, from a 100-year-old down to a baby.
And we have some 100-year-olds.
Yes. So if, you can have these things done on an annual basis, you can really pick up the vast majority of anything that could be going on in your system. So these are basic tests that actually apply to everyone and is very important to determine what your basic health pattern is. Mm-hmm. So we can get so much out of this and prevent so many different types of problems. And the minimum that should be done is on a once-a-year basis. And as I tell people, even who come in and not really finding too many things wrong, that this would be just a good basic type of test to make sure that their health is up and to do this on an annual basis.
But it's not only for wellness, though. It's very important.
Well, it's absolutely essential if you actually have a disease process going on. Mm-hmm. You cover with our very thorough blood tests, with the GI effects, finding out what's going on in through the gut, and the hair analysis. It covers almost everything from A to Z and may not completely give you the total answer that you need. You have to do further testing, but it will certainly point you in the right direction in what needs to be worked on and how to make the biggest bang for the buck in people's health.
And we're talking about the stool, or we call it the GI effects. It just sounds better calling it the GI effects. Tell the patient, you got your stool kit there. So today we're going to talk about our comprehensive stool, or GI effects. It is called the GI effects, so we'll refer to it as that. And one thing that is true, right, Dr. Prather, is that your health is in your gut.
So much of your health is in your gut. One of the things that has taken place is a huge leap forward in understanding the gut and its influence on health. Everyone's heard of the Genome Project, where
maybe not
everyone. Well, okay, sorry.
Unless they've been listening to the radio show.
The Genome Project is where they found out about the genetic sequencing of the human being, and they were able to put that together, and that has a huge implication for the future health of people and the direction that we go in our healthcare system. But there is actually a whole nother system within our body, and we actually have more cells of others in us than we do of ourselves.
What do you mean others?
Well, we have our the cells in our body that are based on our own genetic components. Mm-hmm. But we also have, let's say, critters living in us.
Okay.
And we actually have more critters living in us than we do of ourselves. Not by weight, because they're smaller cells.
That come from the outside.
Yes, that are actually essential for our health and well-being. And the Biogenome Project is a sequencing of all the genetic material of creatures that live in us, and the vast majority of those live within our gut. And if we didn't have those critters in us, we wouldn't be able to function. Mm-hmm. In other words, we are very, very dependent on them for our health and well-being. And it's an essential part of our functioning that those are just as healthy as we are. Okay. So they have done a genetic sequencing on that and found out a tremendous amount. Matter of fact, they have said that without without any doubt that our immune systems, many of the nutrients that whether we absorb our nutrients or not, there's a great deal of effect on our brain chemistry. There's a great deal of effect on our physiology of our body. All starts in the gut, because that's where we actually absorb everything from. So, there's a small amount that comes in through the lungs, there's some through the skin, but 80% of everything that goes into our body comes in through the gut.
80%? Wow.
80%.
So why does the gut have such a big, effect on our immune system?
Well, 80% of our immune system is around our gut, because that's where most infection actually comes from.
That is very high percentage.
That is a very high percentage, and people with immune system problems have to look to the gut. And when I'm talking about immune system problems, I'm talking about cancer. Cardiovascular disease is oftentimes kicked off by infections also. Free radical pathology that affects that. All autoimmune diseases have a huge effect because it's a imbalance within our immune system. You always have to look to the gut for that. And you're talking about Sjogren's disease, Graves' disease, Hashimoto's, rheumatoid arthritis, all those different types of things that type 2 diabetes. All those types of things really are originating in the gut. So a lot of the chronic types of illnesses that people are actually experiencing, osteoarthritis actually originates basically in through the gut. So there is a huge amount of an impact, and to be able to really treat anyone with any of those diseases, you have to go to the gut, and if you are not going to the gut, you are not really treating that disease. So understanding that and finding out what the underlying problem, and many times when people are going from place to place, doctor to doctor, trying to understand and not getting answers for their disease process, then you have to go back to the gut oftentimes to find the hidden problem. Of course, that is a big problem because it's kind of a hidden area. How do you actually analyze it? And with the biogenome project, they have been able to explode. It's almost like a brand new ability to do diagnostics, because now we can do genetic testing. And that testing will actually give us the information from all the way up to the mouth, all the way down to the anus. And it covers the entire thing, and nothing is actually left out. So our ability to actually find out what's going on has just exploded.
Well, let's talk about this comprehensive stool kit you use called the GI Effects. I guess GI stands for
gastrointestinal.
And why is this one that you've chosen to use in your office?
Well, I've been someone who's used the analysis of the stool for ever since I opened up practice, and found it very important. But it has been frustrating because there has been a limitation. Sometimes you could get the information, sometimes you couldn't, that you needed, because it was very dependent on being able to your ability to culture, to be able to get the right. Matter of fact, you had to do actually several different stool samples with the hope that you would actually find what you're looking for. So, there was a very labor-intensive...
That would be frustrating.
Yeah, it was a very labor-intensive type of thing. It was annoying for the patient to do. There wasn't great compliance. And quite frankly, the results just weren't just getting everything that we needed. Oftentimes I knew that there was more going on than the information I was getting back. And now I get more information than I ever could have hoped for.
With this new comprehensive
test. The information that I get in there has really been so thorough that now we can, with confidence, be able to say exactly what's going on in the gut, and that we know what is happening, and also exactly how to treat it.
So why, and you were talking about infections, can
Right.
start in the gut. Why check for infections? What this stool kit called the GI Effects for?
Yeah, and now, because we are actually getting through the new extraction process, we're able to actually identify what those infections are, with an accuracy that is beyond anything that I had ever hoped for.
Okay. You can win a free 60-minute massage in a relaxing spa at the Prather Practice. Each month we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. How can acupuncture help pain?
I've had many patients said that the acupuncture worked better than their cortisone shots for the pain relief. And not only that, but it was they could do it as often as they wanted to. So it's a very nice type of thing. And we use the acupuncture a tremendous amount for any type of inflammatory or painful condition. Very excellent relief.
Well, in a way, is this how pain works? When one of those roadways are blocked, then you have pain, correct?
Correct.
And acupuncture kind of opens that up.
Opens it up, redirects it, absolutely. And we get amazing inflammatory relief. I mean, that's one of the things that we see on a regular basis. And we get quite a few referrals for pain relief from the acupuncture with excellent results.
What if someone's thinking acupuncture, and they're afraid of needles?
Well, the nice thing is that we have, first off, the needles are as thin as a hair. When people think about needles, they think about a hypodermic needle. And you can put probably at least 5, maybe 10 of those needles in one hypodermic needle. So they're very thin. Also, they're rounded on the end. They're not sharp. So, that you get very seldom do you get any bleeding. It's more of a toxic release if there is. But that will actually go in and kind of go between the skin cells. So there's very little problems. A lot of people compare it to a mosquito bite. The other thing is if you are just not going to do needles, we have lots of different alternatives. There's laser, there's electrical, we have an acupowder. I have several patients who do not even ever want me to show them a needle. They will pass out just like that.
A lot of times you don't even feel it.
Well, you don't. You really don't. Matter of fact, I had a patient who was laying down, and she says, "No, I'm deathly afraid of needles." And we're talking, and I'm sitting there putting needles in her, and we're going on and on. And she's laying face down, and she says, "Okay, tell me when you start."
You had already put
I had already done it.
That was sneaky.
She thought it was fun. Well, I wasn't trying to be sneaky. It just went that way. And she says, "Oh, you're kidding. I thought you were just checking the points." She said, "I didn't even feel it."
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
I feel good. I knew that I wouldn't. I feel good. I knew that I wouldn't. So good.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. Today our show is titled Your Health is in Your Gut. And Dr. Prather, we're talking specifically about the GI Effects Stool Kit, which is one of the 3 tests you recommend everyone have on an annual basis, along with the Prather Profile blood analysis and a hair analysis. And Dr. Prather, before we were going to break, you were talking about infections. And the thing that hit me, you said 80% of our immune system is in the gut.
Correct.
So this test, the GI Effects, looks for also infections in the gut, and it can be very specific on what those infections are. Tell us a little bit about that.
Yeah, the 80% of really all infections actually start in the gut. So, having a good picture of that and having a good idea of actually hitting that. And if you actually have a normal gut, you're able to fight off those infections and keep that under control. However, most people don't have a normal gut. Part of the things that can occur is that you have lowered pancreatic enzymes, hydrochloric acid, and that can happen over time through poor nutrition, through stress. Many different types of things can actually cause that. And so when the normal gut functioning actually starts to decrease, and that can happen with taking pharmaceuticals, taking a series of antibiotics. The antibiotics, usually the gut takes about 3 months to be able to recover from 10 days of an antibiotic use.
3 months.
3 months.
Wow, that's a long time.
And oftentimes it doesn't recover. Mm-hmm. Non-steroidal anti-inflammatory drugs have a devastating effect on the gut flora. Many other pharmaceuticals have been shown to actually cause a huge problem. So anyone who's had to take pharmaceuticals for any length of time at all, or have had even one round of antibiotics, should have their gut checked to make sure that it's back up to par. Mm-hmm. You have the normal bacteria, and sometimes people, because their mother didn't have it, don't actually have a normal gut bacteria.
So they can inherit that.
You can actually inherit that type of problem, and if it's not up to par, then that would cause a lot of issues. Mm-hmm. There are also situations, you also have to have something called short-chain fatty acids in through your gut. Mm-hmm. And what that does is they actually nourish the normal bacteria, and then also they feed the epithelial lining of the gut lining. Mm-hmm. I don't want to get too technical because there's an awful lot of things that are involved. You have to have normal pH. You have to have the right fiber amount. You can actually eat imbalanced, too much red meat, too much fat. And all those types of things can actually throw off the normal functioning of the gut. And when the gut goes off through those things, then it makes an opportunistic type of environment for different types of infections to actually come in. The main ones that we're checking on that is bacterial infections that can actually settle into the gut.
And this test can tell you specifically what bacterial infections. Okay.
Absolutely. It will actually pick up, which bacterials are in through the gut. It will also pick up which yeast or fungi that are in through the gut. If there's an overgrowth on that. And then also if there is any parasitic infections in through the gut. And as you can identify those, then you could actually work on getting rid of them. And there are many things that can actually occur with these infections. You can actually have, one thing that we have found is we've had patients with unexplained headaches. Mm-hmm. And there are actually different types of bacteria that are known to cause headaches. There are different bacteria that are very much involved, obviously with H. pylori, Campylobacter, they can cause gut problems, ulcers.
So a compromised gut can even cause headaches.
Learning disabilities. Mm-hmm. I had one young lady who came in with severe abdominal pain, diagnosed with IBS, irritable bowel syndrome, was very tired. We found out that she was chronically anemic. We did a lot of tests. She actually qualified for a blood transfusion for how low her iron was. And we did a GI effects test on her. And we found out that she had a certain bacteria that blocks iron absorption.
Oh, wow.
And they actually eat any iron that she was taking in. So as we were giving her iron, first off, it would cause her constipation. And that was actually a reaction from the bacteria. Mm-hmm. and it would also cause headaches. Every time she ate, she would start to have cramping in her abdomen. And it was all coming from a bacterial.
Wow. Yeah.
And so we discovered that. We started to treat it because one of the nice things about the test is it also will give what it's susceptible to.
What do you mean?
In other words, they grow the bacteria in a petri dish, and then they try different medicines on it
Okay.
and see which one it will react to. Because oftentimes you can actually have a resistance. So we actually get a list of all the different types of products that will actually work on that, which
Interesting.
makes life much easier. So we were able to find that, start her on the products, and her iron for the first time was able to start to rise. Her headaches went away, and she can now eat without any abdominal pain, and that is one happy young lady.
Oh, yeah. Can you imagine the discomfort?
Sure.
A lot of people with GI problems have a lot of discomfort in the gut area.
And of course, her first thought was, "Ooh, I don't want to do that."
Oh, the stool kit.
Right.
Yeah,
But,
the GI effects.
but it was the results on that were
And it's
absolutely
really not
incredible.
that bad.
Oh no, it's
People
just
take
one
the
time.
kit home,
Right.
send it out from home.
Sure. And so the understanding that just had a huge effect. We had a young man who came in, and he was being treated for GERD. Where he was just having, when he would eat, he just had to stay on medications the entire time. He was on Prilosec to try to keep the GERD under control. And that was causing other problems because that was changing, with that medicine, it changes the whole makeup of the gut, lowering his hydrochloric acid levels, so he wasn't able to digest his food as well. He was throwing everything off on that. But when we actually got the test back, he had H. pylori, and that was the cause of his GERD symptoms. So got started on some products immediately on that. That showed up very beneficial. And as he's taking that, he's been able to go off the Prilosec without any
great.
symptoms. And he can tell everything is working better. Because, he was having a lot of joint problems, a lot of vague, achy types of things. And when your gut's off, you don't feel well.
Right.
There are a lot of unexplained things that actually occur.
Well, and we're calling this the blueprint to your health. You found out exactly
Sure.
what bacteria and, otherwise, it's a guessing game.
It's a guessing game. And, when you're also talking about, the low iron is probably the leading cause of attention deficit in young ladies. So, she wasn't able to concentrate because she didn't have enough oxygen going to her brain.
Yeah.
So one of the things that was recommended for her was to take Adderall. So you're starting to get into a whole series of problems along those lines, and you're creating, you're trying to take care of the symptoms without actually getting to the root of the problem.
Oh, and causing even a worse problem.
Even
of
causing
addiction.
a worse problem. So as you are looking at this, you see a whole cascade, and what had happened probably is that at some time she had taken an antibiotic. It had changed the gut flora in there, allowed that infection to settle in, that bacterial infection that actually absorbed her, actually ate her iron up. And then she started to have headaches, bowel, indigestion. She started to not be able to think correctly, so there was a whole cascade along those lines. Without, people were looking at her, her mom was feeling helpless. She was going from doctor to doctor, trying to figure out what was going on. And, it was coming from a bacterial infection that was just chronic in her system. And once we found it, it was amazing what happened.
Yeah, and you said this test can be used on babies all the way up to 100-year-old. I mean, it's
Absolutely.
important because, children go on antibiotics.
Sure.
Unfortunately, too many rounds.
Well, skin problems, on babies, where you actually have the rashes, and that's always, they've done a recent study, and that's almost 100% coming from some type of infection in the gut, usually yeast-related. And as soon as you can find that out and then actually treat that and get that, under control, then you have a reversal of that skin.
What about acne?
Acne absolutely is, you should always check on the gut, because there's a toxicity on that and a very strong correlation with infections. It's interesting, but of course we're doing it with very specific types of issues. But I have not had anyone actually come back without an infection in the gut yet.
From this test?
From this test that we've ordered it on.
Wow. That's how important it is. Because if those infections stay in the gut,
right,
then what happens?
It's a whole cascade of problems. Many of them are carcinogenic, cardiovascular disease, a lot of the things that actually occur on us.
Okay, well, up next, we'll talk about the GI effects and how important it is for irritable bowel syndrome. Listen to the Voice of Health radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
So I pull up at the entrance to the emergency room. No valet parking. I mean, if that's not the biggest oversight in our solar system. If there's ever a time where you want to go, can you park this because I need to collapse immediately? But no, I'm circling around a parking lot. Can I park there? I think I'm going to die. I'm dying too. Okay, go ahead. Yeah, I'll go up a couple levels.
A special message from the DTS Weight Loss Center at the Prather Practice.
Are you tired of making the same weight loss resolution only to end up right back where you started? Let the professionals at DTS Weight Loss Center take all the frustration out of dieting. Our nutritionists and wellness coaches know what works for every body type and can develop a plan specific to your needs throughout your medically supervised program. Make the change by visiting us online at dtsweightlosscenter.com. Dedicate, transform, succeed.
When you call the Prather Practice to schedule your appointment at our DTS Weight Loss Center, mention the Voice of Health radio show and you'll receive a free initial consultation, plus a free body composition analysis. 317-848-8048. That's 317-848-8048. The DTS Weight Loss Center at the Prather Practice. Dedicate, transform, succeed. I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. Today our show is titled, Your Health is in Your Gut. And Dr. Prather, we're talking specifically about the GI Effects Stool Kit, which is one of the 3 tests you recommend everyone have on an annual basis, along with the Prather Profile blood analysis and a hair analysis. The stories that you were talking about with the patients were really amazing. We're going to talk about specifically what this GI Effects tests for. But before we do that, who, as you are evaluating patients that come in, who do you recommend to do this stool kit? And I want to let our listeners know, the stool kit, we go over the directions, they take it home, send it out from home, and it's very painless.
It's very easy to do. That's one thing that with the improved, the complication of actually doing it is so much less than it used to be. So people haven't really mind doing it at all, which is absolutely great. So better compliance, we always like that.
We've had babies do it. You can take it from their diapers. And
Absolutely.
Yeah.
Absolutely. And we basically order that on anyone that has had trouble finding out what's going on in their system. You know, obviously, if there's any type of abdominal distress, that's one of the first things that we look for. So anyone with IBS,
Irritable bowel syndrome.
obviously anyone with Crohn's disease, ulcerative colitis, any type of disease of the bowels, finding out exactly what's going on. Just, you know, we at that point know what's happening on people. One of the things on ulcerative colitis, if you are real low on something called short-chain fatty acids, getting that up to par pretty well takes care of it. So, you know, when we find that type of thing, or we can actually see, according to what's going on, your chances of developing colon cancer. So, you know, looking at all this
From this test.
Anyone who has any type of immune system problems, I look at people's blood works, and they have low absolute lymphocytes. They have some basic white blood cell challenges that are going on. There's a pattern within the immune system that we see. There's an imbalance in the immunoglobulins as we do the blood test. Then I'm automatically thinking there's something going on in the gut, because the gut has such an influence on the immune system. So on those people, you know, finding out what that is absolutely critical. Also, people who have, you know, I had unexplained headaches, and I'm like, there isn't really a musculoskeletal issue that was involved in that, none of the normal types of things that we're looking for. And so we went right to the gut, and immediately found a bacteria that, you know, was involved in that, started on some products, and you know, where the person was having headaches every day, it was gone. So, you know, finding that out and being able to utilize that was very, very critical. Cancer patients always need to have their gut checked because of the huge influence on the immune system, and making sure that that's all taken care of. People with unexplained, very high triglycerides, leading to risk of cardiovascular disease. Oftentimes, that's a weakness in the pancreas, and we can pick that up from the stool kit. And we have actually found instances where definitely the pancreatic enzymes were actually low and kicked off by an infection.
And you're talking about different diseases, but even we talked about this being a real good annual test, you know.
Yes, and
if 80% of our immune systems are on our gut, it would be good for everybody.
It really is actually good for anyone just to have checked and make sure that the health of their gut is up to par. I highly recommend it. We do it for our family. It's all very critical, just for your basic health and understanding. And quite frankly, there hasn't been anybody that we haven't found that didn't need some help.
Now, did you say you have found on it, and everybody that's come in and has done this test, infection in the gut?
We have actually found yes. Now, of course, a lot of our really well people haven't, you know, chosen not to do it. So, I mean, there could be people out there without it, but so far it's, you know, the test hasn't really been out there that long, about a year. So we've done, several 500 or so, you know, tests on that, and everybody's actually had an infection so far.
And if you harbor those infections,
they will always cause problems within your system. And depending on exactly what that infection is, then there are consequences to those. And if you can get rid of those, there's an improvement in one's health. And oftentimes, the main complaint that the individual is you know, actually dealing with, the fatigue, the headaches, the intestinal pains, the not sleep anxiety. We've actually found problems along those lines. There are certain parasites that will actually cause sleep disturbances.
Now, too, what about constipation, diarrhea? Do you see both?
Absolutely, and there is a direct result. Once we do the test and we look at the bacteria that was actually involved on that, one of the symptoms is that it causes constipation or diarrhea. So, there are, the correlation between the symptoms and the actual infection has just been very dramatic.
Well, let's talk about this comprehensive stool kit called the GI Effects, stands for gastrointestinal. And what does it all encompass? What does it cover?
Well, we get a clear idea on how well you are producing your hydrochloric acid, which is coming from your gut, and that's the beginning of your whole digestive process.
Okay.
The pancreatic enzymes, we get a very clear picture of how well that is working and if that needs to be fixed. It's also important that you put bile into your gut for proper absorptions of the fatty acids, which has a big effect on cholesterol and triglycerides.
So it's looking at that also.
It looks at that, and actually we find oftentimes the reason that people have high lipids in their system. Along with that, the basic types of things, we're also looking at, do you have a normal gut flora that keeps you healthy?
So this test will tell you exactly where your gut flora is.
Yes, and it gives us exactly which ones are low, which ones are up. So
when you say which ones, what do you
Well,
mean?
you have actually quite a few different normal gut floras. So we're looking at about 20 different normal bacteria.
And we're looking at which ones. This test looks at which ones are not normal. Correct?
Sure, and you can actually be too high on some of them too. So there has to be a balance between them. And there are many different type of probiotics out there. And probiotics are actually where you're putting the normal gut flora back into your gut. And we have different types of formulations, and being able to figure out exactly which one people need is also something that this gives us a picture of.
Yeah,
so
there's a lot of probiotics out there.
There are a lot of probiotics, and we have a lot of
So this can tell specifically
which one we actually need to use. And then when you can get that up, that does a huge amount of help for keeping further back infections away. If you actually had the digestive enzymes perfect, if you had perfect bacteria in your gut with the right mix of everything, you wouldn't get an infection in your gut because it wouldn't have an opportunity. So these things have to be off to be able to kick that off. Also, we get a reading of what your immune system is doing in through the gut. If it's a very low immune system, then that's actually a problem, and that needs to be rebuilt.
What do you mean by that?
Well, you actually have immunoglobulin A's in through the gut, and that's actually, so you actually have an immune system within your gut that actually kills infection.
Okay.
And there's
so it'll tell you what level that's at?
It will tell us exactly what the level is, whether it's too low and you're not able to fight things off, or if it's too high, that means that you have an active infection going on, an overreactive gut. So knowing that, we can actually give different products that have been proven to actually help to balance that out.
Yeah, it's so nice because this test really tells you specifically, what's going on, and then treatment's easy, I would think.
Treatment is, it makes me look like a genius, in other words. People have come in and they said, I've been, literally, I've had a patient came in, had been to Mayo, Cleveland, John Hopkins, 6 other doctors, and with no results. And within a month, they are healthy, feeling great, and it makes me look like a genius. And basically, I just did a test that they hadn't done yet.
Yeah, which told you a lot.
Which told me everything that I needed.
Right. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, what makes your approach and emphasis on the thyroid unique?
We look at it structure functionally, where homeostasis is what is important. And homeostasis is a balance, and there's a balance in the thyroid that should be achieved, which you can determine. And the people who have a normally balanced thyroid homeostasis is probably less than 1%.
Wow.
Of the population. There are two systems that control the rest of the body, the nervous system and then also the endocrine system. And as I tell the patients, those are the two things that we need to get fixed first. You have to have a proper functioning nervous system and a proper functioning endocrine system to be healthy. And the thyroid is sort of the workhorse of the endocrine system. And many of the problems that we see in patients once we get the thyroid balanced out, a lot of the issues start to clear up. The people who come in here, often 80% of them have had because they felt that their thyroid was a problem.
Had them checked.
Had them checked, and they were told that they were normal when...
Why is that?
They're not doing the proper blood tests. They're not reading them correctly. Doctors aren't being specific enough on what the thyroid number should be. The American Thyroid Association has said that the numbers need to be much, much tighter than what they are. There's a different type of a evaluation. There's reference range, and then there's what is a perfect homeostasis? The labs aren't there to tell you what the blood work should be. They're just saying, of the people who come in here, 50% of them have this number. Reference range has nothing to do with where you should be.
Right.
That's
I know
not
you
what it's
look way
designed.
beyond them, and we tell people, and they come in, well, my doctor said, this was normal. And
I say, no, that's not normal. I even find endocrinologists not reading lab tests properly to really understand where that should be, because when we get people into homeostasis range, their symptoms go away. That's where they go, oh, wow, I feel really great. All the different things that I was complaining about are all of a sudden now working properly, and that's because they are in the range that I tell them that they should be in. Right. Because those are the proper ranges that need to be there.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. Today our show is titled, Your Health is in Your Gut. And Dr. Prather, we're talking specifically about the GI Effects Stool Kit, which is one of the 3 tests you recommend everyone have on an annual basis, along with the Prather Profile blood analysis and a hair analysis. And Dr. Prather, those 3 diagnostics make treatment very easy. We had a prospective patient call that I was on the phone with yesterday, and talking about, like you said, it's been everywhere. And, I said, when you're doing the right diagnostics, it's giving you, the blueprint to your health, and it can really make the treatment easy.
Yeah, one of the things that really makes me look good, within with our patients, is just because we are so thorough with our diagnostics. If you do enough diagnostics, you're going to figure out what the problem is.
And these are, not major. They're affordable.
Right. I mean, these are actually things that if you come in and you're paying cash, you can still pay for them. It's not like, thousands of dollars type
They could
type-
change the healthcare.
Sure. I mean, it's not along those lines, and it's not invasive. In other words, none of these things have any risk to them.
And this GI effect is covered by some insurances.
Yeah, we find about 80%.
Which is nice.
It's very nice for the patients.
So we were talking before we went to break, Dr. Prather, about what is involved in this GI effects. What is it testing for?
Sure.
And I want to make sure that our patients know it's a stool kit, but it's we review that with them, and they take it home. They do it and send it out from home. We get it back within 3 to 4 weeks. We get a beautiful printout that the patient. There's a copy for the patient as you're reviewing. You review that with them, Dr. Prather, at their next appointment.
And the reason that it takes 3 to 4 weeks is they actually grow the infections in there.
Okay.
So that they can actually test them, and then as they test them, they can actually find out exactly what products are actually going to work to get rid of it.
Okay.
So there's actually a testing type of thing. So they grow a culture, and then they play with the culture and find out what I need to give to someone to
Sounds
clear
like
it
a
out.
bunch of scientists, huh?
Yeah, fun, huh?
Yeah.
What do you do? What does your son do?
I play with bacteria
Yeah.
in a petri dish.
But the other things that show up in this is how much inflammation is in through the gut. So there's actually a measurement on that. There's actually a measurement of several different chemicals, which means a lot to me, but won't mean anything to the patients. But it gives me a very good idea if there is an inflammatory condition in through the bowels. And
Do you
if there's-
see that a lot?
We see that a lot.
Yeah, inflammation is a big problem.
And one of the things that we always think of is if there is inflammation, then we think of food allergies.
Okay.
And of course, one of the main things along those lines is celiac disease. Then if we see inflammation, we'll go on ahead and order some blood tests and find out exactly what foods people are actually reacting to. And we can find out if celiac is actually an issue. But the stool, this particular GI effects test will give us a very good indication.
You
if
can
that's
call it a
something that
stool.
needs to- yeah.
It was just that we were saying it, it doesn't just sound appropriate at the office in the front office. So, but yes, that's what the GI effects is.
Well,
Stool
also
kit.
along those lines, I mean, we measure out the pH of the gut, which is absolutely critical with an extreme accuracy. And there are many times that we just need to change the pH. Or it even gives an indication if people's diet is out of balance. You really need to eat a lot more fiber, a lot more vegetables, and really cut down on the meat and the fats. Or people are actually eating way too much sugar, and that needs to be dropped down. So, looking at that, it actually gives us a tremendous amount of information on dietary changes that people need to make. And we can actually measure that and see if they've done it, because it shows up in the bowels. So anything that is out of balance is
Are we
very
talking about
important.
homeostasis?
We're getting into homeostasis, and that's what I want people to understand, is that as we are doing our practice at our office, we are a structure function office, where we are looking to balance out the structure, the skeletal structure, the muscles, the ligaments, tendons, so that things are where they should be. We also are involved in balancing out the physiology of the body. And one of the main areas of getting a good balance into the system is in the gut. So getting the right bacteria into the gut so that you have a well-working gut, making sure that you have the nutrients in there. We have very specific products that provide the short-chain fatty acids that are necessary to keep the good bacteria and the colon functioning properly, which is absolutely critical for keeping a lot of the diseases away, keeping the infections down, and actually preventing cancer. Finding out exactly what invasive organisms are in there, whether they be bacterial, yeast, fungus, or parasitic, and then finding out exactly how to get rid of those. And then also looking at are your digestive enzymes being produced properly? Do you have a proper balance in your diet? And as you can get everything balanced into a normal homeostasis, then you can actually start to function well. And if you don't have a functioning gut in homeostasis, you are not going to be healthy.
Well, let's talk about can this benefit by doing this test, the GI effects, in weight loss?
Oh, absolutely. There are actually a whole class of bacteria that are known to cause you what they do is they produce fat. So
What produces fat?
The bacteria in your gut will make you fat. And
There's a lot of things that'll make you fat. Huh?
yes, well, if you have general inflammation.
Right.
So one of the important parts of actually looking at a weight loss program is that you actually need to find out what's going on in the gut. If you're not digesting right, if you have a toxicity in through the gut, if you have certain bacteria or parasites or food allergies.
So it's more than just counting your calories.
It can be. And I've had people who were very frustrated, with what was going on with their weight. And to find out that there was actually an infection causing a lot of their weight gain made a very big difference. Because the body has to be functioning correctly to be able, and fat is actually a balance of homeostasis. And there can be many different types of ways that can go off. We look at all of those: the endocrine system, the dietary types of things, and the normal gut flora. And the gut has to be right to actually get that back into par.
Yeah, I mean, if 80% of the immune system's around it.
Sure. We had a gentleman who came in, and he had struggled with his weight and said, I'm exercising. I am, cut down on my calories, and I put on 5 pounds. And I said, well, okay. I said, let's do the GI effects. And he actually didn't do it at the beginning and then decided to just because he was frustrated. We found it, and he had a very large colony of this particular bacteria in his gut. And
Do they tell you the size of the colony and the test?
They actually do.
Wow.
So, we actually get numbers, very exact numbers, and where it is. And it's nice on the test, it actually gives you a line. So it had that particular name of that infection, and it had by it, a fat-producing bacteria. And his number was, there was a line there from normal to abnormal, and his was off the chart.
Off the chart.
It was off the chart. And interestingly enough, we gave him the products that actually showed up, and he came back the next month, and he said he had lost 13 pounds.
Wow.
Everything started kicking in.
This was
all
a fat-producing bacteria.
Fat-producing, that actually is known to cause you to get fat. And just treating that bacteria, it's like, of course, everybody's going to be running in and, well, that must be my problem. It's not always, but it's certainly something to eliminate.
Sure. Yeah.
And then everything started to work, and he's like, I lost 13 pounds, and I feel so much better. So, finding out on that, we had another individual had constipation their entire life, and that's always what they struggled with. And that's annoying. And what did we find? We found a bacteria that was known to cause constipation. It was one of its main symptoms. First time in her life that she's ever actually been able to go to the bathroom without help. And that was, she actually cried. Because that was always one of her main concerns.
Well, constipation's not normal, and I just got a phone call from a mother the other day that had heard about us, and her baby has since she was born having constipation. I said, and they were told that that's just normal. And I said, no, that's not normal.
That's not normal. Mm-hmm. That is not normal. And I had one poor young man who came in, and his problem was that he had diarrhea. Mm-hmm. And
that's what he was coming in for.
Sure. Mm-hmm. And he had to plan his life around his diarrhea. Mm. And it was very difficult, to go to college and actually dealing with that.
When you're in class, oh boy.
Yeah. And there are times that he's taking a test and he's not allowed to leave. Mm-hmm. And, he's like, I've tried everything, nothing's working, and we found a parasite. Mm. And this particular parasite was well known to cause diarrhea. And he came in and he was just so happy. He's like, I don't have a diarrhea anymore. Wow. Mm-hmm. And this
changed his life.
Right. This is the first time ever, and he has dealt with that, since he was a baby. Mm-hmm. His mom said he had to go through, there was all sorts of considerations as he went through school his entire life.
Yeah. Well, I hate to say this, Dr. Prather, but we have about 30 seconds just to wrap this up. It's been very helpful, very informative on the GI effects.
And the big thing that we look at all this is, what is the underlying cause?
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.